Okay. Chalo. See if it is. Okay, my dear friends. Now we are going to take up. I think Dr. Pavan was taking your lectures earlier, and now we'll have a change of guard for a few weeks. I'll try and finish up occupational health in the meantime. You have seen how diseases are transmitted due to occupation, how we have diseases which are causing occupational cancer, occupational dermatitis, various methods of prevention of occupational diseases. So you are quite experts now, and we'll try and cover a disease which was very common in our country earlier. We have had a decrease in this now, that is lead poisoning. See, lead is a bluish gray metallic element which occurs naturally in small amounts in the Earth's crust. It is dense, hence it is used as a ballast. What is a ballast? A ballast is basically something which is used in ships, heavy things, to displace a particular, to displace water. It is a sort of an inert compound which is there, heavy and inert. Is used in ammunition and also used as a radiation shield. We in the medical industry, we do use lead in a number of places when we talk about radiology or radiotherapy. So when you come to the radiology department, you should go and see how a radiographer or a radiologist will not carry out any X-ray unless and until he wears an apron which is lined with lead, so that the radiation does not come through to him. Second, every door, every location in the X-ray department is lined with lead so that the radiation doesn't come through. When we talk about the various types of rays which are there, when we talk about nuclear, biological, chemical warfare, we will tell you as to exactly alpha rays, beta rays, gamma rays, and X-rays. So alpha rays which will not go even through paper, beta rays which will go through the skin, and gamma rays which will go right through the bone. So those are different types of rays which are there. We'll talk about those in detail when we talk about nuclear, biological, and chemical warfare. Now at the present moment, talking about going back to lead, lead is insoluble in water, but some salts of lead are soluble. So when you just look back at history, Egyptians used this in pottery to glaze the glass, glaze the pottery. Even today lead is used in, if you find a nice glass, which you call them cut glasses, and you find the glass is shining, well, there is a quantity of lead which has been put into it. So lead is being used since a long time. Hippocrates in 370 BC talked about lead colic, and Ramazani, who is better known as the father of occupational health, is in 1713 talked about the tremors which took place with lead. The Factories Act of 1883, from which our Factories Act has come, mentions about the problems of lead. And we have this great man, Sir Thomas Legge. I am very fond of him. His sayings are tremendous. One of his sayings, Sir Thomas Legge, he was the first medical factory inspector under the Factories Act. He was the first medical inspector of factories. So Sir Thomas Legge mentioned that if you stop the inhalation, you'll stop the poisoning. So this gives you an idea that inhalation is the one which is really causing the whole problem. Inhalation, we'll talk about it in detail later, but inhalation of lead fumes is what really causes most of the problems in industry. So where do we get the lead from? Lead you can get from galena, cerussite, and anglicite. That galena is lead sulfide, found with sulfides of silver, bismuth, arsenic, and calcium. Cerussite is lead carbonate, and anglicide is lead sulfate. The biggest problem in lead was due to two things. Lead in industry is one thing, fumes, that is one thing, but the poisoning in lead was due to two major causes. One was lead paint, and second was tetraethyl lead, which was used in petrol. So lead paints, you see, lead paints give you a good shining finish. The finish of paints was better when lead was added to it, and it also remained for a much longer period. So, but what was happening was lead paints were creating a lot of problems, whether during the manufacture of lead paints or when the lead paints used to be used in the houses and it would flake and you have children eating it, and various other problems which took place, or painters who got involved. So lead paints was creating a lot of problems, and this was banned in the US in 1978, as they were the earliest to ban it. India banned it somewhere in the 90s. The automobile industry, which is there, was having tetraethyl lead. Now, tetraethyl lead was added to petrol because of the fact that petrol per se was causing knocking of the engines. So when tetraethyl lead was added to this petrol, the knocking of the engines was decreased. So this used to come out in the emissions, and everybody who was there on the roads were inhaling this particular lead compound. So what's the different forms of lead? How do we use them? As we mentioned, they use for shielding in the radiation industry, but also used for shielding also in dents, in filling up dents in cars, shipbuilding industry, trucks, and lead shots when you're using in rifles. Inorganic lead, that is lead and antimony together, are used in batteries, ammunition, and ornaments. Very useful in ornaments, and also, I told you, it gives you a proper finish which is there. So used in ornaments. Also increases the weight of the ornaments. So a lot of jewelers use it for increasing the weight of the ornaments so that they can make a little bit of money on the side. Lead, antimony, and zinc. The combination of this is popularly used in soldering. Lead compounds called litharge or lead oxide, used in electric accumulators, and red lead, as it is called, is used in paints, glass, enamel, pottery, and ceramics, basically for increasing the shine. The other uses of lead, which have not been covered, if you look at it, it's everywhere. In cables, in galvanizing industry, in annealing industry, in plating, electroplating, in insecticides, in automobile radiators, brass and bronze production, in the construction industry, in the ammunition industry, in the printing industry, yes, also in the printing industry, plastics, televisions, electronics, petroleum is used in lots of places. So that's the reason why you must know about lead poisoning, because it can occur in various places. Another is we have the great science called Ayurveda, which uses metals. A large number of metals, including lead, is used for treatment. Not only in Ayurvedic, but also in Chinese remedies, you have got lead being used. And 40% of the Ayurvedic medicines have one or other heavy metal in it. And you should be very careful when a patient comes to you who says that I've been taking Ayurvedic medicines since a long time. You will find possibly that he is having a toxicity of one or other of the heavy metals. It is thought by practitioners to have therapeutic properties and to increase the efficacy of other herbal contents, and that's why it is used. It keeps on accumulating, so as maybe it's effective, I will not comment on that. It may be efficacious, but it gets accumulated in the body, and once it gets accumulated, then it creates toxic problems. So let's go on to what is lead paint, which is the most common component which is used. Lead paint uses lead as a pigment. It was advantageous, as I said, because it improved the sticking quality of the paint. Also, the drying was rapid, weather resistant, and the coloring was good. It gave you good shine. There are two types of it: white lead, which was basic lead carbonate, and red lead, which was lead oxide. Now, pre-1960, up to 40% of lead in paint was on lead paints. Then after that, they started decreasing it. And the domestic paint now has very less amount of lead. It still has lead, but very less amount of lead. Lead paint is also used in many homes, walls, furniture, toys. Now I mentioned toys specifically because toys are the ones, all these toys which are imported from China, huge number of toys. What does a small little baby do once a toy is given to him? Pick up the toy and put in the mouth, and you will have that toy leaching lead into the system of the child. So you're lucky if the Chinese toy does not leach much lead, but in due course of time, as I said, with the chronicity of things, you give him more and more of these toys which are having lead paint, and you can have your child having lead colic after some time. So lead exposure from paints is also due to, you have a process called sanding and heat stripping, flaking. All these are there in industry, which may have been taught to you by Dr. Pavan. I will not go into the details at present because otherwise it will take up most of my time. But I will, if the portion which is prevention of occupational diseases has not been covered, then I will cover this during that time. So flaking and pica. Flaking, you see what happens when paint gets old, it flakes off and then it falls down. It falls down on the ground. And what does the crawling baby do? He just picks it up and puts it in the mouth. Everything goes into the mouth as far as the small baby is concerned. Be careful. These are small. You can land up with a child coming up with toxicity with eating lead paint. Also, those children who are fond of pica, that is eating mud, etc., they can land up with problems. It contaminates the carpets, curtains, dust everywhere. It can. So how can it enter the body? The most important place that it enters the body is through the respiratory tract. As I said, the fumes was the one which Thomas Legge also talked about, Ramazani also talked about, everybody talked about it, and we'll repeat it now, that dust and fumes are the ones which will cause the maximum damage. Breathing in dust that contains lead, and lead is absorbed and distributed to other parts of the body via the bloodstream. So the 50 to 70% of what is taken in gets absorbed, 50% to 70% of the. So now, as far as ingestion is concerned, where you talked about babies having it, but if it is adults who have it, the absorption is about 6 to 10%. Fasting adults can possibly absorb a little bit more, but children, they absorb much faster, 30 to 50%, even if they're well fed, and more if they're fasting or malnourished. So, and what happens is when they are anemic, they have less amount of iron or calcium, the absorption is even faster. In water, what about lead pipes? We have had huge amount of lead pipes which have been laid earlier. Nowadays we use plastics and various other compounds which are used, or we are using various other types of pipes. But lead pipes are used earlier, and whether it's from solderings and fittings, they can leach into the water. And we have some amount of absorption which takes place, leaching of the lead which takes place. And WHO did a survey which they found that 20 to 30% of homes exceeded this limit of 10 micrograms per liter. What about skin? Skin, the absorption is not very good. It's relatively impervious to lead, lead oxides, lead salts. Some may get through scrapes or wounds. If there's direct transmission, then it will be there. Will go through the skin into the bloodstream quite well. So where does the lead go once it enters the body? Lead is absorbed into the bloodstream, then it travels to the soft tissues. The soft tissues means the kidneys, lungs, brain, spleens, muscles, heart. But if the absorption continues, then it gets deposited into the bones and teeth, and that is the problem. Once it goes into the bones and teeth, coming out is problem. But 94% of adults' total lead burden is in bones and teeth, and in children, you see, children, the basic reason difference is there, but 73% in children, 94% in adults, because chronicity is more in adults. Adults will continue to take it for a number of years. Children are young; they won't have had so many years in their life. So that's the reason why in children it is little less. Lead in bones and teeth equilibrates over time and circumstance with other compartments. You see, if you find that the bones, the lead is more and it's not there in the bloodstream, some of it will come back into the bloodstream, or some of it will come into soft tissue. So equilibrium is maintained. So where does it come out from? The urine, 90% of it comes out from the urine, from the renal tract. Biliary tract about 10%. So only two ways that it comes out from: 90% from the urine and 10% from the biliary tract. From the bowels, it is not much. It is not much. From the biliary tract, maximum excretion is 3.5 micrograms per day. If can be excreted out, so if the intake is more than 3.5 micrograms per day, the accumulation is occur. Now, bowel, sweat, breast milk, these are all very small amounts of lead will come out. Hair, nails and teeth, there is deposition, very slow turnovers. It takes more than 10 years to turn over 1/2 of the body's stored lead. 10 years for taking out only half of the stored lead. Bone source, this bone source will leach into the bloodstream after some time. And rapid turnover, soft tissue pool was so the T half, that is the total lead which is there in the body, will become half in turnover in 30 to 40 days. That is in the blood, liver, kidney and central nervous system. And as far as the T half for skeletal system is concerned, as you mentioned earlier, 10 years is what we are looking at, 10 to 20 years. So that's what we're looking at. So chronic exposure results in a steady state of distribution of the lead in bone and blood. And what is the problems? Problems are numerous, and these problems, please remember that lead inhibits certain types of enzymes, particularly the enzymes of the sulfur-hydryl group, and therefore it has got effect on almost most of the systems of the body, whether it is neurologic, endocrine, reproductive, musculoskeletal, blood, renal and GI. First and foremost, of course, we must mention about the microcytic anemia, which can occur with basophilic stippling. So this is a very characteristic of lead poisoning. And look at what are the problems which can occur in the GI tract. Now, if you start looking at it in the GI tract, depending on the concentration which is there in the bloodstream, you can have abdominal pain, vomiting, constipation and loss of appetite. So abdominal pain, classically known as lead colic. So this lead colic which is there, you can have either a pain or a colic. You can have constipation, you can have abdominal pain, constipation and loss of appetite. As far as the blood is concerned, we talked about the basophilic stippling which is there, but it leads to an inhibition of the RBC enzyme. So once that takes place, you have anemia. Anemia can be mild to severe. The more problematic areas are the CNS, the central nervous system. You have initially possibly a defect in the IQ, and then mild fatigue, irritability, slowed motor neuron conduction, loss of concentration, peripheral neuropathy, and then finally encephalopathy, which is characterized by delirium, ataxia, fits and coma. The other problems which can occur is muscle pain, hypertension, nephrotoxicity, a lowered vitamin D metabolism, And the physical findings which you can get are a typical wrist drop, loss of distal sensation, loss of proprioception, vibration sense loss, all these features of CNS problems which are there. And the chronic problems which can occur are transverse nail lines which are there, lines on the nail, a transverse nail line which is there, or blue and black line on the gum lines which are there. A peripheral neuropathy which is there, distal symmetric axonal polyneuropathy, that is what is the correct terminology which we can use, distal symmetric axonal polyneuropathy. And these involve the wrist drop, foot pain, joint pain, and a decreased dexterity. Also, the other symptoms of central nervous system problems in adults is irritability, impaired judgment, depression, ataxia, hallucinations, seizures, hearing loss, diminished judgment, a decrease in memory, and decreased cognition. So, a large portion of the problems are related to the central nervous system. What about children who are exposed? The cognitive performance deficits which take place in children can result in psychomotor performance deficit, auditory and language processing deficits, sustained attention and concentration problems, and they will be less likely to reach even high school, and you might find that they're more likely to be convicted for felonies or some other problems. So like they say, I was seeing some movie where they said chemical locha for all these psychiatric psychological problems. Yes, there's a lot of things which now are coming through which say that there's a lot of chemical locha which takes place. It's not really that psychotics are mad, but it is they have a lot of chemical locha. One of the chemical lochas is lead. What will happen if there's a lead exposure for the mother and she has got an excess of lead? Lead crosses the placenta, so that's the problem which is there. Pregnancy and lactation cause lead release from bone stores into the plasma, and plasma lead is about 1% of circulating blood lead. So you can have central nervous system problems, and the peak transfer takes place in 12 to 14 weeks of gestation. This is what happens in utero. If the dose is low, you can get a low birth weight, or this can increase if the child comes with a low birth weight and continues to take breast milk which is containing lead, the child can have more and more problems. However, with higher doses, you can have spontaneous abortions, stillbirths, and neuropsychological problems in children. So this, basically, if you really look at it, we are not so concerned about the lead colic which everybody talks about, lead colic and the stippling in the gums which is there, stippling in the of the RBCs, as well as nail lines and gum lines which are there. Those are only features for us to realize that we're going to head for further problems, and these further problems are related mainly to the central nervous system. Other systems are also involved, but central nervous systems which are mainly not reversible. As far as adult reproduction is concerned, we have problems in the female reproductive tract, the miscarriages, stillbirths, inability to conceive, while males can have decreased libido, decreased fecundity, sperm abnormalities, counts, abnormal forms, and there is a dose and response relationship. That means increased dose, you have decreased amount of sperm count, that sort of thing which is there in both males and females. Now we talked about central nervous system. Let's go to the other problems which are there. Kidney and the lead nephropathy which is there, which is known as Fanconi syndrome, is characterized by amino acid urea, glycosuria, phosphaturia, and hypophosphatemia, and a decreased uric acid excretion. So basically what we are looking at in Fanconi syndrome is we have lead as well as uric acid both of them creating problems. Also, it can result in chronic kidney disease, and we already mentioned that uric acid excretion is poor. Once the uric acid excretion is poor, you can land up with gout. So gout is another problem which can occur in these patients. What about the other systems which are there? The other systems which are involved is hearing, the eighth nerve damage which can take place. Gout we've already talked about. In GI, you have a patient coming with anorexia, he may have vomiting, he may have pain in the abdomen, he may have colic. So all these things you also can land up with constipation. In the endocrine disabilities problems which are there, vitamin D metabolism can be a problem, and this is known to have genotoxicity also. What do you do in a case of lead poisoning? Now, if you have got a patient with lead poisoning, especially a patient who is there, we're talking about occupational health, by the way. So I'm talking about the rest of the children, etc., because that is associated. But basically, we would like to concentrate on occupational health. And that, kindly remember, a person who is working in industry, you must identify that person and remove him from source. What did I say? I said that mainly it is by inhalation. So a person who is working with a lead ore and for extraction of lead and lands up with a problem, we must remove him from the source. We come to know that he's got high amount of lead in his blood, so we must remove him from source, or we get some features of lead poisoning. Treat the coexisting iron and calcium deficiency which is there, because as I mentioned, iron and calcium deficiency can result in increased absorption of lead. And consider the use of chelation therapy. Good data for benefit with blood lead of 450 micrograms per liter. We have got chelation, which we can. There are lots of good studies which are there. With children, you do a chelation and you can get the lead out. So what do we use? EDTA and DMSA. Sodium calcium editate. It can be given IV for severe toxicity, particularly encephalopathy is well tolerated, and less than 1% of people develop nephrotoxicity. Well, as far as dimer-captosuccinic acid, 2,3-dimer-captosuccinic acid, which also used as a chelating agent, this can be given orally and given on a 19 days course, well tolerated, but the problem generally the patients complain is the foul taste and smell of this particular compound. But if they can tolerate it, this is an oral compound and can be given, so it is much more easily given. Now these are treatment guidelines which we have, which are generally they're used in industry for 100 to 400 microgram per liter. You just remove from the source and just wait, because you don't need to chelate for such levels. Repeat the levels at 3 to 6 months. At 400 to 500 micrograms also, we really don't want to take them off, give them a chelating agent. Just take them away from the source and repeat the levels after 1 to 2 months. Now, why I put this question mark and remove from the source is many a time one really doesn't come to know where the source is. It's okay in occupational setting, you can know that the source is from that particular setting. But many a time in a home environment, you really don't come to know where is the source of this particular lead poisoning. If the person is sitting in a house which has got paint peeling from it or from some other place which is there, you can identify. But if he's got a lead painted room, small little room which is leaching paint, and he says that I am unable to repaint this or to scrape it down and repaint it, it becomes very difficult. So removing from the source sometimes is a little difficult. Okay, now 450 to 690 microliters you remove from the source and chelate with the dosage which is there, 1050 milligrams per meter square or 700 milligrams per meter square for 14 days. 1050 if you want to give for 7 days. 14 days if you're giving for a longer period, you can give a smaller dose. Also then for those who have got higher than 690, for that you'll have to give a slightly higher dose of the chelating agent. The key to treatment of lead poisoning is lowering the blood levels by oral chelation, but the key to everything is always remove from source. Remove from source is the biggest and most important thing to be done, because if you keep the person near the source, you keep on adding on, you can keep chelating, but there's no use. And when I talk to you about prevention of occupational diseases, we will talk about the substitution, engineering, personal protection, work practices, job placement, all things which should have been taught to you. We don't know whether it has been taught. I'll find out from Dr. Pavan, and we will talk about it. And the Factories Act says that the exposure limit which is there is 0.15 milligrams per meter cube. And STEL, unfortunately the class is not around, so that for me to ask, what is STEL? Yeah, Ritika, can you tell me what is STEL? I've got a PG here, so she can tell me. She's now searching the net for it. STEL is short-term exposure limit. That means within a short time, person can get toxic. So the short-term exposure limit is 15 minutes. So if he's going into, say, a tank which has got lead fumes in it, it's permitted only 15 minutes of it, and the short-term exposure, the maximum which is there, is 0.45 milligrams per meter cube. So we must ensure that the person is removed from the source of this particular. Yes, that is all that I have from lead poisoning. I hope that I have conveyed what's the importance of this particular disease, and you will be able to write at least a short note on lead poisoning, which normally you get a short note on lead poisoning. You should be able to write a short note on lead poisoning, or you get a question on lead poisoning, and then you get a question which says write in detail about prevention of occupational health disease. So we will talk about that if it has not been covered, but otherwise I hope the matter has been conveyed to you and you will be able to write well on lead poisoning. Thank you.